Hi everyone, my name is Rabia Barka, and I will be presenting on Broca's area. So just to begin, Broca's area was first discovered by Paul Broca himself in 1861 through several case studies that indicated similar deficits with language expression. And overall, Broca's area mainly contributes to the language production, some comprehension, and is said to be a factor in the motor movements as well. It can be found within the left frontal lobe, but more specifically within the inferior frontal gyrus. Its main blood supply comes from the middle cerebral arteries, and lastly, Broca's area makes up Brodmann's area 44 and 45, which contributes to motor and speech production. Now, there are various types of aphasia, but Broca's aphasia is classified as an expressive or non-fluent aphasia. So those diagnosed with this specific aphasia have trouble with language expression in both writing and speaking. It may sound broken or in shorter sentences, but a majority are able to comprehend what is being said. It's just more of the issue with expressing. Most of the causes are due to age and health. So one cause of the damage can be from loss of blood supply from the middle cerebral arteries that result in having a stroke. In addition, tumors or growth that can cause added pressure can result to the loss of blood supply and further damage the Broca's area. And finally, traumatic brain injuries such as car accidents. The main advancement or form of treatment is intervention with an SLP, where they begin to introduce and work on creating communicative strategies to overcome breakdowns. Augmentative and alternative devices are introduced as another form of communication when breakdowns become more frequent or an overall just depends on the severity. Medication is currently still being researched. Memantine or paracetam are used to increase blood supply. There is no actual medication that is used to cure Broca's aphasia. Typically, this area isn't seen to be infected until a later age, but that doesn't eliminate the fact that damage can occur at any time. It should be noted, though, that within the first 3 months of pregnancy, the nerve connections for the brain are developed. By age 6, we have about 90% of our brain developed, and typically by 25 years old, we have a fully developed brain. On the other side, though, strokes become more common at 65 years and above, thus causing damage. And in addition, tumors and brain growths continue to become a developmental issue. Some general practitioners can be the first to initiate the process of discovering underlying issues, but more so they're used to refer to other healthcare professionals who prefer or may offer other supports. Next, we have the neurologist, who will then give an MRI or CT scan, which provide more insight for either being referred to an SLP or as well as other higher treatments to begin. A pharmacist can be used to provide and obtain the prescriptions that we had mentioned previously. And lastly, but certainly not least, we have the speech-language pathologists. Their jobs are to create treatment plans that are used to teach client strategies for communication breakdowns, and in addition, they can provide sessions on how to integrate AAC devices into everyday living. So, for the methodologies and techniques, MRIs and CT scans can serve as a primary option to obtain more information on what is occurring within the brain without performing surgeries. MRIs are more detailed images of specific organs, and CT scans are similar by providing more in-depth imagery through X-rays. Assessments are used and can vary based on different types of aphasia, but based on my research, the Western Aphasia Battery Revised is used to assess language, mostly after TBIs, but can be used to track the progress of someone during intervention with an SLP. So moving on to recent advancements or more so research, I found most interesting was one case study or research study done on melodic intonation therapy. And so this type of treatment is interesting because it incorporates rhythm and intonation for single words, phrases, and then sentences. From the videos that I watched, MIT sounds kind of like they're singing a song to make sure that the phonemes are correctly pronounced and easier for the client to produce. This specific study was done on a 70-year-old man who spoke Jordanian Arabic. The research began over an 8-week period intervention with an SLP. The results appeared to show significant gain of expression when utilizing language with melodic intonation strategies in both self-generated and automatic phrases. However, the specific research was conducted on one participant, which thus only was evaluating one dialect, and in addition, the research can't be used to generalize a full population, but overall it was very interesting to read and how this is incorporated for an SLP. So with the transition of lifestyle comes different supports to be included as well. From a familial and friend perspective, it is always great to include them in the process for the individual who may be affected from Broca's area. So with that being said, building positive communication strategies, such as slower rate of speech, less open-ended questions, and overall being more aware of how best to assist those will help them with the overall lifestyle transition. We want to become more aware and supportive to those individuals as best as we can, and having communication strategies can relieve added stress or anxiety from them. In addition, individuals dealing with Broca's aphasia or overall damage to the area are advised to continue with speech-language therapy. As previously mentioned, earlier intervention is vital and can directly impact. Furthermore, AAC devices can be introduced if language expression becomes too difficult or frustrating for the client. Thank you so much.